How to Become a Home Health Aide in 5 Steps. Brought to you by medicalfieldcareers.com. What is a home health aide? The core function of all home health aides and personal care aides is to assist people with disabilities, cognitive impairment, and chronic illnesses in their day-to-day lives. The time could not be better to become a home health aide because the job of a home health aide is growing at an incredible 41% nationally, according to the latest stats from BLS.gov. What is the process to become an HHA? Step 1. Have or get your high school diploma or GED. Step 2. Take accredited HHA training classes. Step 3. Complete the program and state required hours. Step 4. Get your HHA certification. And Step 5. Finding a job as a home health aide. Step 1. Have or get your high school diploma or GED. This is the most important requirement. If you have your diploma, you are on your way to becoming an HHA. Step 2. Take accredited HHA training classes. Taking the right course will set you up for success and allow you to get certified in your state. Making sure your education is accredited in your state is vital. There are also online options for HHA training like Home Care University from the National Association of Home Care and Hospice, the NAHC. Most community colleges have the NAHC certification courses available, and once you finish the program, you will take the NAHC exam. The NAHC exam is 50 questions and costs $140. A great resource for finding accredited training is from the ABHES, Accredited Bureau of Health Education Schools. Step 3. Complete the program and state required hours. Most programs and states have a requirement of 75 hours of on-the-job training with 16 hours of clinical training. The list on the right shows all the mandated training and clinical hours per state. Step 4. Get your HHA certification. The national certification option for HHAs is the NNAAP certification. The NNAAP certification will open more doors for you than any other home health aide certification out there. This certification is the one that certified nursing assistants get. If you are getting on-the-job training, then you will probably take exams at work or online. If you take an HHA training course, then you may also take it online or in the facility itself. Step 5. Finding a job as a home health aide. The first step is to look at the 3 types of work environments that are common to home health aides. First is client residences. Most HHAs will work in clients' homes. Secondly, personal care aides and home health aides work in nursing homes and long-term care facilities. Lastly, they may work at health centers and hospitals. Choosing which environment is best for you is the most important choice to make when looking at your first job as a home health aide. Before you go, check out the $1,500 medicalfieldcareers.com scholarship. Fill out our application form and submit your 1,000-word essay on why you want to work within the healthcare field, and maybe you can get some of your home health aide education paid for by us.